Hello everyone, this is Dr. Shyam. I welcome you all to my channel Dr. Pharma, and on this video I'll be discussing on factors affecting wound healing. Wound healing. What is wound healing? Wound healing is the response of the body cells to cell injury to restore the normal structure and the function of damaged cells. So normally there are two factors. One is local factors and then next one is systemic factors, which will affect or which will influence the process of the wound healing. We'll be discussing one by one. First we'll be discussing about local factors. In local factors, it includes infection. Now try to understand here that suppose anyone is having a wound, or he or she is undergoing the process of wound healing or suffering from any kind of a trauma, or you can say an injury to the cell, and he or she is that undergoing the process of wound healing. In that case, if there will be a presence of infection, means wound healing is taking place and that individual is also having some kind of infection. So try to think practically what will happen. So of course there will be or infection. Any infection at the time of wound healing will decrease the process of wound healing. Yes or no? Try to think practically. If at the process of wound healing, if any individual is having infection, this will decrease the process of wound healing. Next is poor blood supply. Poor blood supply. See, at the time of wound healing, if that cells is not getting enough blood supply, so what will happen to the process of wound healing? Of course, you can say that there will be or poor blood supply will decrease the process of wound healing, because you know that the blood functions of blood, there are many functions of blood. It will carry the oxygen, it will provide the nutrients, it will remove the waste product. But remember that if the blood is not supplied in adequate amount to the cells which are healing, then it will decrease the process of wound healing. In that point, remember one thing. See, if there will be any injury to the facial part, like if there will be any injury to the facial part, the wound healing will take place rapidly. In the foot, or you can say the leg, if the wound healing is taking place in the leg, it will be slow. You know why? The thing is that because of blood supply in the facial part, the blood supply is high. So due to the high blood supply, the wound healing in this part, facial part, will be taking place very rapidly, whereas in case of leg, or you can say the lower part, the wound healing might be slow. But remember that when there is a poor blood supply to the the cells which are healing or which are going through the process of healing, it will decrease the process of wound healing. So that is the second point. The next one is foreign bodies. Foreign bodies. So again, what will happen if there is a presence of foreign bodies, or you can say any microorganism? The same, it will decrease the process of wound healing, because it can cause the infection which can decrease the process of wound healing. So remember that the presence of foreign bodies at the time of wound healing can decrease the process of wound healing. So that is your next point. Moving to the next one, movement. Of course, the movement at the process of wound healing will decrease the process of wound healing. Remember that. Suppose you are just going through the process of wound healing, and if you are moving, if you are running, you are doing exercise, everything. I'm not telling that you should not move, but you should take care that it should not affect the process of wound healing. If you are moving and to that where the part is injured, while moving or while doing exercise or while running, it may affect to the process of wound healing, or you can say that the movement can decrease the process of wound healing. The next one is, or next factor is exposure to ionizing radiation. So at the time of wound healing, if that wound is exposed, or if that cells which are undergoing the wound healing is exposed to the ionizing radiations, you know, that alpha rays, beta rays, gamma rays, so what will happen then? Of course, you know that those rays are very harmful to our cells. It will decrease the process of wound healing. Moving to the next one, exposure to UV rays. Exposure to UV rays, that is ultraviolet rays. See, all these factors are decreasing the process of wound healing, but this exposure to ultraviolet rays will increase the process of wound healing. The question is why? Because you know that, see, I'm talking about the, you know, I'm not talking about the harmful UV rays. The UV rays coming from the sun are harmful as well as they are beneficial also, because this rays is helping, you know, helping in the formation of vitamin D. What we are telling now, that we are getting vitamin D from the sun. We are not getting, I'm telling that we are not getting directly the vitamin D from the sun. The vitamin D is formed in our body itself, but the UV rays is helping that formation of vitamin D in our body. So this UV rays, I am talking about the beneficial UV rays. If it falls on the skin or that part of the cells which are healing, that will increase the process of wound healing. So remember that all these factors are decreasing the process of wound healing, but exposure to the, you know, good UV rays will increase the process of wound healing. So this is all about the local factors. Moving to the systemic factors. In case of systemic factors, the first one is so you know that if you are young and if you are having any injury to the cell or injured cell, the process of wound healing is very rapid. The process of wound healing is very rapid, whereas in case of old patient or old person, the process of wound healing is slow, because you know that while in case of old age or when we are growing old, the cells and the tissue are not functioning well, you know, they are just they are unable to function well because of the old age. So remember that in case of young patient or young person, the process of wound healing takes place rapidly, or they are rapid in nature. In case of old person, the process of wound healing is very slow. The next is nutrition. So what will be the effect of nutrition to the process of wound healing? I hope now you are able to give the answer. So see, deficiency of the vitamins and proteins, what they will do, if that person is not taking the adequate amount of the vitamins and the proteins, of course it will decrease the process of wound healing. Remember that. So at the time of wound healing, if the individual is not taking an adequate amount of the proteins and the vitamins, of course there will be a decrease in the wound healing. So you can say that the proper nutrition is also required at the process of wound healing. Otherwise, the deficiency of the proteins, or you can say the deficiency of the nutrients, can decrease the process of wound healing, and it may take a longer time for the wound to heal, right? And then next is uncontrolled diabetes. Uncontrolled diabetes. So you know that the diabetes is diabetes mellitus is disorder, metabolic disorder, in which there will be a excessive amount of the glucose in the blood linked to hyperglycemia. So when there will be when the patient is having diabetes mellitus, see, the they are more prone to get infection with the microorganism. And there are many other complications. I'm not going in detail, but remember that if any patient is having diabetes and they are undergoing the process of wound healing, so this disease or this disorder will decrease the process of wound healing. So what is the effect of diabetes to the wound healing? It will decrease the process of wound healing. Then the next is hematological disorder. You can say neutropenia, decrease in neutrophils, or you can say anemia. Anemia means, I hope you know that, decrease in RBC is known as anemia. Or you can say any other blood disorder. If anyone is undergoing the process of wound healing, and if that patient or person is having, individual is having the hematological disorder, means blood disorder, I wrote here neutropenia and anemia. There can be other several types of blood disorder. So what they will do, this will decrease the process of wound healing. So remember that the hematological disorder or blood disorder will decrease the process of wound healing. Then the next is systemic infection. See, systemic infection means again any infection in the blood. Any infection in the blood, or you can say the inside the body, it is called systemic infection. So again, you know that the infection will decrease the wound healing in case of local factors you had seen. In case of systemic factors also, if there is any systemic infection, or you can say any infection is there present inside the body, then it will decrease the process of wound healing. So these are two factors, local factors and the systemic factors, which can which can affect the process of wound healing, and they are as follows. And remember that all those factors are decreasing the wound healing except this one, exposure to UV rays. That's too, I told you, the good UV rays. If it is harmful UV rays, then again it can decrease the process of wound healing. So this is a brief information regarding the factors affecting wound healing. I hope the information is very useful and knowledgeable. Please like, share, subscribe, and don't forget to comment on my video. Thank you all.